So at this time, won't you receive our sister, Dr. Ayla Stanford. She's going to come and just give us some background on what has happened, where we are, and where we're going. Amen, amen, amen. And then we will go to God in prayer.
Good morning, everyone. Good morning. And thank you, Pastor Waller. In my time with you this morning, I want to talk to you about where we've been, where we are, and where we're going. Okay. 15 months ago, in this parking lot, on April 20th, 2020, cars were lined all the way down this street. 500, 600 cars of people. And we tested them. People came in cars, they came on foot. And when we got to the cars, so many people were so sick they couldn't even stand up to get the test. There were people, when we called them back, they were in the hospital to give them their results. And some people did not survive. 1 in 4 people in this parking lot had coronavirus. There was no place for you to get a COVID test. The doctor's offices were closed, but you needed a referral. You went to the emergency room and they turned you away. How do I know? Because all of you all and your friends of friends were calling me saying, I can't get a test. So then I spent all my days calling to get you in to get a test. And everyone that I called for had coronavirus because all of the testing sites were in affluent white neighborhoods. That's not my opinion, that's fact. So when this happened, there was no prevention, there was no cure, there was only testing and contact tracing, and we didn't have it. We were the ones who were contracting it. We were the ones who were dying at a greater rate, and that's when I decided we had to form the Black Doctors COVID-19 Consortium. It was for us, by us. And even then and now, the children who have died the most have been Black and brown. The elderly have been Black and brown. Even the doctors and nurses in the hospital and healthcare people and who just work in the hospital who perished were predominantly us at greater rates. So I set out to change that. And now we've had an opportunity to look at the data. And it wasn't just what people said, oh, they had chronic medical conditions, or they were poor and Black. No, it was rich and Black, poor and Black, with insurance. The common theme and thread was that you were Black. And now when you look at all the data, the variable that most predicts your outcome is the chronic exposure to racial discrimination. Are you hearing what I'm saying to you? That's even with all of the adjuncts. So let's fast forward 15 months. We're here now. No one needs to contract COVID, be hospitalized, or die because the vaccine reduces COVID disease, the severity of disease, hospitalizations, and death. But since last month, the cases have increased 251%. That's not even a number, 251%. Now 1,000 people an hour are being diagnosed with coronavirus. But you wouldn't know that. Everybody's getting on planes. They're going everywhere. You walk in the mall, nobody's wearing a mask. 40,000 people are diagnosed a day in the United States. 97% of the people with COVID in the hospital right now are not vaccinated. 99%, that's almost 100% of the people right now who have died were not vaccinated. See, that's a difference than July 2020. And 83% of the cases right now are the Delta variant. And for those of you who don't know, that's a different one from the original one. It is 1,000 times more contagious. 1,000 times more contagious. So it doesn't take much. Soon, all of the cases will be this Delta variant. So let's talk about why people aren't getting it. Well, I'm young, I'm healthy, my immune system is strong, I don't get sick. I take my supplements, I take my vitamins, And that's great, and you should. But that's not going to prevent you from contracting coronavirus. It doesn't predict if you'll have a good outcome or a bad outcome. And we talk about hospitalizations and death, but there's a lot of people who survive that are not the same, that will never be the same, who can't breathe when they walk, who have headaches all the time, who have chest pain when they take a breath. They're miserable. Number two, I've had COVID. I'm protected. I got antibodies. You do. Some of you do, but not everybody who had COVID has protective antibodies. And let's go a little deeper. Having had COVID with antibodies is like getting one shot. Most of us who had Pfizer or Moderna got 2 shots, or Johnson & Johnson is 1 but conveys the same protection. So that means, yes, you had it. Maybe you have measurable antibodies, but you only got 1. It's not a full protection. Additionally, when you measure it, we don't know how well they work. It's like a person who has legs, but they're paralyzed and they don't work. You see the legs, they should move, but they don't. That's what we know about the antibodies we measure. We don't know how they work. Are they really protective? Number 3, this is to annihilate the black race. This vaccine is to kill us off. That's why we shouldn't take it. Well, let me tell you what is killing us. The violence in Philadelphia, okay? These shootings every day. Last week, a child died every day last week. You know what else? The drugs. And you can call it the opioid epidemic, okay, but it's really weed laced with what? It's Percocet mixed with fentanyl. It's Adderall that someone sniffed up their nose. It's cocaine. It's drugs, whatever. It all went up. And then you add COVID on top of that? That's 3 pandemics, epidemics that are wiping us out. So when you want to talk about annihilation, it's not the vaccine, it's the disease. Number 4, children don't need to be vaccinated. They don't need to wear masks in school. My kids can't breathe when you put that mask on my child. I'm a parent, I'm not getting vaccinated, so my child's not going to get vaccinated. Our children right now are sick. They are dying because of us. The children are getting sick from unvaccinated adults. That is fact. And as I told you before, greater than 50% of the children who died look like you and me. So come on, can we do it for our children? Okay, number 5, I need more time. I need some more information. Nobody knows what the long-term side effects of this. So I can tell you this, the extreme adverse events happen within 2 months of you receiving the vaccine. I am at 8 months, so I got it before all of y'all, and I'm still standing. And if and when the booster comes, I'm gonna get it before all of y'all. So you all can look at me and see how I'm making out. If I don't do so good, you might choose not to take it. But the way things are going right now, if and when it happens, I will receive it. Again, we are in the 4th surge. The 4th surge. The numbers right now are as bad as January. Y'all remember all the people that had money enough to travel and said, you know what, it's not going to get me, and then came back from wherever they were and spread it some more? That's what the numbers are like right now. If I get vaccinated, I can't have children. I'm going to be infertile. That's not true. It's no evidence. I'm not even going into that. If enough people get vaccinated, I won't have to, because we'll reach herd immunity. Right now in Philadelphia, 73% of people have had 1 dose, but 58% are fully vaccinated. You know what that means? It's 42% out there who are not. And that Delta variant is replicating and spreading, and every time it replicates, it mutates, it becomes more difficult to attack and treat, which means the vaccine I got ain't gonna protect me after a while, because the vaccine is getting the virus is getting stronger and stronger. And soon, it's not going to be Delta. It's going to be Lambda, and our vaccine ain't going to do nothing, okay? So those of you who have been vaccinated, you might want to talk to a friend that hasn't and tell them, yes, it's your choice. Yes, I respect your choice, but your choice is impacting my life and my children's lives. And I need you to think again. I need you to look in the mirror. No, you can't get COVID from the shot, and my faith will protect me, as will God, so I don't need to get vaccinated. So I'm going to come back to that. That's where we were, where we are, and where we're going. And this is a to-do list. Talk to your friends. You know who they are that's not vaccinated. You know who they are. At this point, you know. It's an act of love, honestly. When they want to come to your house, when they need you to give them a ride, tell them, look, babe, I love you, but I can't do it. I can't do it because my grandma, she got vaccinated, but her immune response isn't as strong. I got to protect her. My mom, she had cancer. She's on chemotherapy. Her antibodies don't work as well. My child, she got lupus. She got to take steroids. She can't mount an immune response like you can. My father just got a transplant. He has to take all these medications that prevent him from mounting an immune response. And finally, my children, my 11-year-old twins are too young. And every time an unvaccinated adult comes near them, that increases their chance that they could get sick and not, maybe they don't die, maybe they are healthy, but maybe now my child needs oxygen. Maybe now my child can't run like he used to run because he's short of breath. People getting fired from their jobs. Make sure if you say you don't want this vaccine, it's a real reason. Don't be losing your job, your livelihood, how you gonna support your family because you believe in it. Come on. Seriously, make sure you got your facts straight. I'm telling you what the facts are, okay? Don't believe no conspiracy, nothing on the internet from somebody who might have graduated from high school, okay? I can tell you that I was in school for 18 years to be board certified to take care of adults and children. And I'm from here, okay? I wouldn't put nothing in my body and give it to my child and come here and tell you if I didn't care about you and want you to save and protect your life. When you go in certain spaces and you don't know if people been vaccinated or not, keep your mask on, protect yourself. You running around the mall, you know certain people ain't been, you know they ain't been vaccinated. Get some cuter masks. Make it match your outfit. Put it on. It's not gonna hurt you. When you get in the parking lot, take it off, get in your car. Protect yourself, y'all, because it's coming in the fall. The numbers are going up. And yes, we may reach people one at a time here and there. The cases are going up. We've read this book. We've watched this movie. We know how it ends. It's exactly what happened 8 months ago. We know. So, this was not my plan. This was no one's plan for us to have a pandemic. I was enjoying my life with my husband, as a surgeon, with our kids, happy for the investment I had made in my life and living off my laurels. And then this happened, and I couldn't watch one more Black, brown life be lost when I knew there was something I could do about it. So when we talk about our faith, we talk about divine intervention and a plan God has for us, this must have been his plan for me. Because I did not expect nor anticipate that everything I thought I worked for in my life would lead me to be doing this right now. But I am following his path. And every time I make a plan, he changes it. Every time. So now I'm just going with it. I'm just praying on it. God, order my steps. Because so many of you started to use us as your primary care doctor, we created a Center for Health Equity. We're starting with our children, supposed to be cutting the ribbon in October, but y'all needed us now. And so I'm mentioning next week, Monday, Wednesday, Friday, we'll be doing PIAA exams for the kids that need them to participate in sports and couldn't get it this year for whatever reason. They couldn't get it. It's $30. A lot of the coaches are paying for the kids to get it. We'll be at Deliverance from 9 to 5, Monday, Wednesday, Friday. And we know kids sometimes have heart problems when they participate in sports. We will be doing EKGs at no extra charge. We know that kids at a young age develop kidney disease. We will be doing urinalysis. And for the weightlifters that need the specific gravity, we will be doing that as well at no additional charge. If you're exposed, the children are exposed to COVID and they need a COVID test, when they come see us next week, we'll be doing that for no additional charge. And if they haven't been vaccinated, we will also have all 3 vaccines next week for our children. You all, I love this city. I love my people. I love my God. And I would not believe he brought us this far to leave us. God bless you all.